Does it feel like medicine has failed you? It's all pills and procedures? Have you seen the overreach in healthcare policy and politics? I want to empower you with the knowledge that you need to make your own best decisions. Welcome to the UnderdogRN podcast. Knowledge is power, so empower yourself. So today I want to build your knowledge in regards to the type of healthcare that we have, the healthcare practitioners that you see in everyday practice, and kind of what that means for you when you're searching for healthcare and where you want to get it, who you want to go to. Being able to answer these basic questions is going to provide you with some answers as to why when you go to your doctor, sometimes you leave with more questions than answers, and why it takes so long to get to the root of an issue that you're looking to get treatment for. So first off, we have a conventional model in the United States or in Western medicine. Now, what that means is that typically what we use for providing healthcare is pharmaceuticals, surgery, or radiation. So when you Google that definition of conventional medicine, you get that it's the type of medicine used in the Western world. When you look at the National Institute of Cancer, it says that it is the treatment or healing of disease with the use of drugs or pharmaceuticals, surgery, radiation. So when you go to your doctor and you're looking for the root cause of your dizziness, your heart palpitations, your inability to sleep at night, they are going to do some basic digging for that root cause. But the majority of the time, they're just going to offer you a solution, and it's going to fall into one of those couple of categories. A med that helps you sleep, take some melatonin, some trazodone, something like that, that's going to put you to sleep at night. Or if you have some other kind of issue that they're going to run tests, right? So they'll check some basic lab work maybe, depending on how severe the issue is or what it could be related to. What we don't look at is how's your eating, how's your exercise, how's your sleep, are you getting a well-balanced diet, how's your vitamins, are you deficient in something? A lot of people don't realize it, but they're deficient in vitamin D. We don't spend a lot of time outside anymore. You know, people work inside jobs, and we don't have a well-balanced diet. Everything is fast food, and you know, it's more expensive to eat fresh ingredients than it is to just go get something out of a box. So you're going to lack nutrition with that. Your overall health is not generally what the picture or concern is. You know, they want you to come in for yearly physicals, right? So you come in and you're having a rash. Okay, well, did you switch soaps? And there's a few basic questions that go into this. But unless it's something really bothersome, okay, take some here's some hydrocortisone cream, or, you know, take some Benadryl, something like that to treat it, right? And manage it. It's kind of the same situation I talked about in the introductory episode, where my grandmother was given these prescriptions while simultaneously scheduling a procedure. So if we're going to start a drug, why would we start a drug if we don't even know for sure the cause, right? So, and this is just a good example because it's really recent in my mind, but with this issue, right, anybody, having some kind of problem, okay? In general, you have nausea. That's a very broad issue. It could be your GI tract. It could be electrolytes. It could be a food that's just not settling well with you. It could be a number of things: exhaustion, dehydration, medication that you're taking. I mean, nausea can have a very wide differential diagnosis for what's causing it. So not focusing on your overall health and how you're doing, instead it's start another pill, right? Here's some Zofran, here's some Fredagon, Compazine, whatever it is. Here's something that'll take care of the nausea. Do you really just want to end up on a cup full of pills? because that's what we're doing. I mean, that's what we're doing in healthcare. Anytime somebody has an issue, you know, spend about 2 or 3 minutes trying to address it generally, and then, you know, here's what we're going to give you for it. It takes a lot longer to dig into somebody's eating habits, exercise, hydration, sleep, stress management, all of those kind of issues. So when we do that, that's how people end up on 4 million medications, which is great for the pharmaceutical agencies and companies. But the problem is for you, right? If you have to get your pills filled every month and you're on a fixed income, you know, healthcare has become so expensive that people can't afford it. Just simple healthcare. So what we need to focus on is the root cause of the issue. When you look up functional medicine, this comes with a lot of different labels: functional, integrative, holistic, alternative, complementary. There's all different ways of looking at it. But this is looking at treating the root cause of the issue, finding the root cause and treating it. That's what functional medicine providers do. So why isn't that our primary system here in the United States? It doesn't make any sense. Why would you not want to get to the root cause of an issue and treat that so that this person doesn't suffer from that anymore, and only use pharmaceuticals and surgery as a last line? Because when you put somebody on a blood pressure pill, they're expected to be on that forever, or until they decide to change those lifestyle factors that contributed to them having high blood pressure in the first place. Unless it's a very rare thing where it's genetic. Okay, genetics play a big part in things, but you can overcome a lot of that with your lifestyle choices. And we don't really promote that. So by doing this, we are removing the accountability and responsibility for your own health by just giving you a pill, by just doing a surgery. You know, I personally, when I got pregnant with our second son, I had COVID before that, the year before that, lost my taste and smell. And then all of a sudden I started having these changes where things tasted and smelled horribly. It was awful. And I'm probably going to say this wrong, but it was paranosmia. And basically it's where things that like smell sweet or have a strong flavor or smell to them were just awful. It was just awful. So what I have found out since is that COVID actually kills the nerve endings in your nose and the olfactory nerve and atrophies it and damages it. And that means that it will make everything just terrible. Well, add pregnancy on top of that, and it just took it to an extreme level. And so I lost 35 pounds in the first trimester. And I'm going to my mainstream or conventional OB, and they're just telling me if I lose so many more pounds that they're going to put a NG tube in, so a nasogastric tube, which runs from your nose down into your stomach. And I'm going to have to do feedings through there. So I'm in the first trimester. How in the world am I going to work? I'm currently, at that point, was a charge nurse in the ER on a travel assignment. How am I going to work in the ER with violent and aggressive patients or any kind of patients? I mean, what would that look like, right? You come to check into the ER and boom, there's a nurse sitting there at the desk with a tube down her nose. That's not going to work. And my functional OB was talking about TPN. So a PICC line, a central line that goes into typically your upper arm and runs and dumps into the big vessel of your heart. Well, I can't work in the ER with that either, really. You know, that getting pulled out or something is not going to work. So I ended up actually getting an infusion of vitamins, minerals, and things like that at a clinic that does functional and conventional, kind of a combination of medicine, which I think is really great for people. They get to the root cause, but they offer you these are all the options you have from a functional side and from a conventional side. And I felt so much better just from getting hydrated and having those vitamins and minerals replaced. And then one of the providers there just made this offhanded comment and said, well, I don't care if you have to plug your nose and shoot your food, blend it up and shoot it, like shots. You have to take in some kind of nutrition because the baby will get what it needs, but you won't. And I mean, I looked terrible. Dark bags, just awful, had no energy, was sick all the time. And so I tried that. Well, by plugging my nose, it turned that all off and everything tasted perfect. It all tasted fine. So from then on out, I went and bought a nose plug and it looked absolutely ridiculous, right? I'm sitting here with this big nose plug at a restaurant and I was able to eat. So now that isn't them, diving deep into it. And I had to figure out what the cause was. I did some research on my own and everything, but that helped me so much. And I've helped other people since. So that's what I'm talking about. When we get back to the basics of anatomy and the root cause of the issue, like what happened, like this was just kind of emerging at the time about how COVID, like why it was taking out your smell and taste and everything. And I don't know if that works for everybody who's lost their smell, that if you plug your nose, your taste buds still kick in. And so things taste fine, but it's worth a shot and it's a very simple fix. So that's what I'm saying we need to look at. When you look at the practitioners in U.S. healthcare, in conventional medicine, you have physicians, practitioners, clinicians, providers, doctors. So really, just for simplicity's sake, when I say doctor, provider, physician, I'm meaning a MD or a DO. So a medical doctor or a doctor of osteopathic medicine. Because when you say the word doctor, that's just meaning somebody basically with a doctorate or, has that level of education. Like you see Dr. So-and-so is actually like a principal or superintendent or somebody at a school. Now they have absolutely nothing to do with medicine. It's in education. You actually have a doctorate of nursing even. And so sometimes you hear nurses wanting to be called doctor because of that education. I don't think that that's necessarily accurate because you're wanting the prestige and respect that comes with being a physician or a medical doctor when your doctorate is in nursing. Now, I will tell you the amount of school that goes into a doctorate of nursing is more than what a medical doctor goes through. So it's kind of interesting when you look at the education required in different levels of nursing versus just going to medical school. But the knowledge is different. And when you look at a medical doctor or a doctor of osteopathic medicine, so a DO, an MD versus DO, that's one of the differences, is the education is a little bit different. Currently, they have combined the accrediting bodies. So basically the organizations that give doctors their accreditation or their schooling, like saying, yes, you completed this, and so now you can take these exams. Those have combined. So now you can go either path, and it's basically the same. The only difference really in the education from all of the research and articles that I've read and a couple of the different physicians that I've talked to is that a DO receives about 200 hours of this hands-on training and interventions. But the couple of DOs that I've talked to, they didn't really get any training or experience in how to use those or using those in like practice. So taking those skills that they were taught and applying them. There's only been 2 instances where I've ever observed something that was different from what traditionally or that you would see in conventional medicine. One was a DO who was a hospitalist, and they actually came into the patient's room. They'd been suffering from a migraine. We've given them all these drugs. It's really not getting any better. And before they did like a neurology consult or something else, they came in and tried to do some, I think it was pressure point kind of manipulation or stimulation to try and resolve that patient's migraine. It didn't really work for that person, and they kind of looked around like it was weird because we in our society are not used to somebody trying something like that to relieve our migraine after we have gotten all of these medications or anything else. It's woo-hoo science. It's whatever. It's just not even, well, that's not scientific. Why wouldn't using natural processes within your own body be unscientific? Would it not make more sense that we use our own body to heal it or to help it than to take a bunch of drugs created in a lab and swallow those every single day for the rest of our lives? So I think that we need to have an approach that combines this. I think looking at an approach that uses functional and conventional medicine in a balanced way. We don't have to give everybody a drug right off the bat to hide or band-aid their problem, but sometimes functional can't fix it either, right? We specifically in our country have had a very poor diet, exercise, stress management, all of that. We have to get back to the basics, and we have to accept some responsibility and accountability with our own health. That, I think, is huge. Healthcare as a whole needs kind of a revamp. We incentivize and monetize these pills and procedures and surgeries and all of this stuff that really doesn't fix the problem and can lead to a lot of other problems. And we do have some really great things, right? Antibiotics, absolutely wonderful. That is undisputable. But it's the same thing as when we have like your ALS and BLS, right? So CPR certification, advanced life support. That's what providers will take, or clinicians, nurses, doctors will take. And that's like the next step up from just your basic CPR. And it's the drugs and interventions with shocking different rhythms, things like that. It changes. The algorithm changes. The steps that you're supposed to take, like the flow chart, it changes. So they had taken lidocaine out, and now they've put lidocaine back in. The amount of breathing versus compressions, different stuff like that. So we don't even have it nailed down what we should be doing in these situations. And the outcomes are different. There are so many factors that go into whether CPR or the drugs that we're giving work. So we need to take a hard look at what is the best thing for the person with their situation. If you don't know what is causing the problem in the first place, like we have H's and T's is what we're taught, okay? So these are different factors that could have caused this person's heart to stop or for them to go into respiratory arrest where their respiratory drive is not working either. So that's like a blood clot, low oxygen. They've taken blood sugar off of there, though every healthcare professional I talk to, that's one of the things that you're going to get in a code too, is just check their blood sugar, because if it has dropped clear off the map, then that's something we need to be supplementing through the IV. So we have some basic causes that we've narrowed down to. But what about all these other factors in this person's care? If they're diabetic, their blood sugar, right? If they have respiratory problems already, are they more likely to be suffering from this or that? We have to have the whole picture to even narrow down to those H's and T's that they talk about. That's what I'm saying. This needs to be about the person in their individual needs rather than a quick fix, rather than taking a look at things. So if somebody comes in to the doctor's office with a blood pressure of 220 and they're fine, they're completely asymptomatic. They're not having any headache, any dizziness, anything like that. They're just coming in for their regular checkup. Their blood pressure has been running high for a while. Their body has adjusted to that high blood pressure. Now that's still wreaking havoc on the body, right? It's still destroying vessels or causing damage to them. It still puts them in an increased risk for stroke. So we need to do something about that. But just dropping off and saying, okay, we're going to start. So ABC, so ACE inhibitors, that's how we do blood pressure meds, okay, is ABC. ACE inhibitors, beta blockers, calcium channel blockers. It's a type of antihypertensive, so a type of blood pressure medication. And we start with this kind, then go down. There's a few factors, age, other comorbidities, so diseases that they might have or health conditions. But generally, that's where you'll start. Okay, then let's use it for the Band-Aid that it is, not a full life solution. Because if this person's making health choices, decisions that have led them to have this high blood pressure, are there any other factors that we can treat and get them off of these medications? Why is there not a focus on that? Your doctor gives you a 30-second lecture. Oh, well, you need to stop eating so much salt. You need to lose, 30, 40, 50, 60, 100 pounds, whatever. Set you up with no tools for success, no thorough education, no applicable solutions. You're expected to go out here and learn it all on your own. I have personally experienced this with cooking. Okay, so when I was growing up, it wasn't easy for us to afford, healthy choices or be able to prep long meals because it was just my dad. So a lot of things that we ate came out of a box or a can or a drive-through, which set me up for a struggle in trying to figure all of that out. And so I am now backtracking, trying to learn healthy habits and push those, onto my kids. Making them, okay, we're going to have fruit at each meal, or we're getting rid of and cutting out these processed foods, or if you can't read the ingredients on the back of the box, it's very processed and we probably shouldn't be eating it. So now my husband and I, we're taking these steps to try and do this. We really want to cut out fast food, drive-through, all these things. But having the support and the education other than just having to, you go online, there's 4 million places to learn all these. Well, this is best. Well, this is best. Well, this is best. And so it's really hard to really figure out what you need to be doing other than just going with if it's not natural, if it's not, something that has just grown in my garden or from a local farmer, it makes it really hard to piece all this together yourself. And then how to figure out how to make that convenient with a fast-paced lifestyle. You're starting out at a disadvantage. Why are we not helping people make these healthier choices, making it applicable? Right? That's what we need to be incentivizing. That's what we need to be pushing healthcare professionals to do, is to promote an overall better lifestyle. And with this fully conventional model, it's not going to work. So my hope is that you learn something from today, just the basics, right? We just got to define the terms of where we're starting so that we know what direction we need to take it. And I can't wait to bring you interviews with a dietitian and an MD, a DO, a PA, an NP, so that you can really hear from them what it's like from their side. I hope that you'll subscribe, follow, find me on all the platforms that I'm putting everything out on. If you have any questions, don't be afraid to comment below, and I will get back to you with anything that I can. If I don't know, I will find the answers for you. Thanks for watching. Have a great day. Thank you for tuning in today. I hope that you found some of the information insightful and helps you advocate for your own care or someone else's. I want to encourage you to follow me on Twitter, Rumble, YouTube, Telegram, and my Patreon coming up soon. You can also find me at my website, UnderdogRN.com. Knowledge is power, so empower yourself, and let's make it make sense.